Well, you got to have health insurance, and it's got to work with your budget.
The Affordable Health Insurance Plan was created by over 1,000 independent physicians. And if you live in Douglas, Sarpy, or Pottawatomie County, you can take advantage of this plan.
You sure can. With us now, Dr. David Allen and Dr. Robert Falk. Great to see you guys
Welcome
again.
back.
Thank you. You guys had a great Thanksgiving,
Good
right?
to see you again. We
Yes.
did. Yeah.
Thank you for having us.
Fantastic. Well, we're here to talk about MIPA, which is Midwest Independent Physicians Practice Association. Give us a little bit of history on that. We've had you on the show before. For our viewers that haven't seen that, explain what it is.
This is the third year that MIPA has had an insurance product. MIPA was originally started by a group of independent physicians here in town. It was started as with just a bunch of probably over 700, 800 independent physicians that are not affiliated. Maybe they're not employees of CHI, now formerly Allegiant, now CHI, or the university or Methodist. And we figured out that we had a great opportunity with all the independent physicians to form a cost-saving group and then an insurance product that really could save patients money.
There was strength in numbers there.
Absolutely.
For you, and then also for patients, because I think we wonder, like, who knows you better than your doctor? So who would know what you need better?
Right.
So this plan, what is it? What is it like? How is it different from other things that our viewers might be familiar with?
Yeah.
Well, I think that probably the main difference right now is that we probably have the broadest physician network out there, so that patients have the broadest access to a wide range of physicians, including primary care physicians as well as specialists. Right now, actually, there would be over 1,000 physicians in our group, in the MIPA group, that are, if you enroll in this health plan, not including mid-level providers, including nurse practitioners and PAs and so forth. So that would be one big benefit. But I think the other big benefit would be the quality of the care with an extremely competitive cost.
Yeah.
So we're one of the few plans on the exchange across the nation that have done well over the past 3 years.
And I think that's one of the, I want to get back to the reason why you guys started this. 'Cause back when we had all these changes in healthcare coming, the care aspect was one of the major pieces why this group was started and why this insurance plan was put together. Can you expand on that a little bit?
Right. So the care, when you're at your physician visit and you come up with a plan with your provider that you need certain things, maybe a CAT scan, maybe an MRI of your brain. Dr. Falk mentioned that we've done okay because our physicians know where you can get those tests done at a less expensive place. And I don't think a lot of people realize that if you have that test done as an inpatient in one of the hospitals, you're going to pay 2 to 3 times the price for that test. So if your physician is working closely with you and they know that you're interested in costs, as most people are with the MIPA product, they're going to help direct you to a place where you can get that test done less expensively. And that helps keep your insurance premium down. So a premium is one thing to think about. When you look at your premium and you say, oh, this premium's $5 a month more or whatever, that's just the tip of the iceberg, right? So, when you get in with your physician, you're going to have all these additional
The out-of-pocket
stuff. So maybe I don't know if I don't think we're exactly the cheapest, but the long term throughout the year, I think you're going to really get your costs back.
And I think it pays to be thoughtful,
Yeah.
because ultimately, I mean, you look back on the year and you feel like you went with a plan like this and you were saving money along the way. That affects your personal economy, right? Are you hearing that from people who maybe been in the plan now for a year or two and they're starting to wrap their heads around what it means to them?
Right.
Yeah, absolutely. I think the one thing that we all experience as physicians and PAs and so forth is that people are paying more and more out of their pocket every year for healthcare, even though they're paying premiums for a healthcare product.
Yep.
So I think one of the differences for MIPA is that when you're the patient and you deal with a physician, you're dealing with the CEO of the organization. We get it because we're hearing from you directly. And we understand your concerns about healthcare costs and your money coming out of pocket. And so we try to be the best stewards we can of your money coming out of your pocket.
Yeah, I want to back up just a little bit because I think it's important to know what this is so they know how to find the product. It's the health insurance exchange, or they call it the marketplace as well. So explain what that is and then how you get to your product.
Right.
So basically our product is on the exchange, so you can get there via 2 ways right now, healthcare.gov or Aetna.com. Those are the 2 ways you can access the products on the exchange right now, and specifically our product. So the healthcare exchange, just to briefly recap, was was created, 3 to 4 years ago, part of the ACA Act. And so what the exchange is basically the advantage to people is that you can go to the exchange and see all of the healthcare products available and listed and compare them against one another by those criteria. So it's an easy way for patients and the people to go to one site and get a lot of information and compare plans.
So that's the benefit of the exchange to our community, that it's one stop instead of you're trying to sift through everything online and then your head's still spinning. We saw on that graphic a moment ago, this isn't, like there was a deadline here, so you would sort of stress that, I'm guessing, because things opened up a couple of weeks or so back.
Right, and I think you have until December 15th. If you sign up by then on the exchange, then your coverage will kick in on January 1st. If you wait until the end of December, then February or more later, a little bit later. But you have until, I think, the end of January.
Right, to get signed
open
up.
enrollment ends January 31st.
January 31st. But I really encourage people who are interested in this plan. Aetna.com is one of the websites, and then healthcare.gov is the other website that they can get to from that plan.
But open enrollment goes through January 31st. So those words, sign up now, it's a call to action for a reason. We've all got to do it. Fellas, thank you so much for being here. It's good to see you again.
Thank you.
Thank you, and have a great
Thank you.
Christmas.
Thank you too.
What is for lunch?